Distinguished guests, esteemed colleagues, and passionate advocates of gender-based violence, good morning all. I warmly welcome you to this joint UN webinar, From Evidence to Action, Leveraging Evaluation for Effective Responses to Gender-Based Violence and Violence Against Children and Adolescents. This event aligns with the current 16 days of activism against gender-based violence, emphasizing the critical role of evaluation to advance the global response to one of the most pervasive human rights violations. Evaluation provides data and measures for progress and lack thereof. Malawi was one of the 5 pilot African countries that implemented Spotlight Initiative on ending violence against women and girls. One of the key outcomes of the Malawi Spotlight Initiative program was a national GBV observatory hub, or rather an integrated management information system hosted by National Statistics Office and 6 district GBV data hubs that feed into the national hub. These hubs provided evidence for policymaking, prompt response, prioritization, and further program designs. The data feeding into the hub was collected from local communities through the joint GBV monitoring architecture that was established collaboratively by UNDP, UN Women, UNFPA, UNICEF, National Statistics Office, Malawi Police Service, Ministry of Health, Ministry of Gender, Local Government, and Ministry of Justice, all these under the coordination of the UN Coordination Office. This opened an opportunity for the creation of an integrated case management information system between the police, the judiciary, and all other actors that work on cases. We are honored to have with us distinguished presenters and panelists from the evaluation offices of UNFPA, UNHCR, UNICEF, UN Women, UNSDG, System-Wide Evaluation Office, and the Spotlight Initiative, who bring the commitment and perspective of diverse organizations to our discussion. Today's event brings forward the collective findings of recent UN evaluations to illuminate not only the challenges, but also the pathways for stronger, more harmonized, and transformative GBV programming. We will explore what the evidence tells us, where the gaps remain, and how the system can mobilize more effectively to support survivors, prevent violence, and optimize GBV programming. I will now hand you over to my esteemed co-chair, Esme Stewart. Over to you, Esme.
Thank you very much, Dr. Chimbiri, and a very warm welcome to everyone who's joining us today. It's a real privilege to co-chair this session on behalf of the European Union, because for us, addressing gender-based violence is a fundamental prerequisite for achieving sustainable development. Today's webinar is an important moment. The evaluations we will hear about offer invaluable insights into what works, where the gaps remain, and how we can collectively do better. This is critical at a time when crises are multiplying and civic space is shrinking. I'm grateful, therefore, to all our speakers and participants for contributing to this conversation. Your expertise is essential to translate evidence into action. So thank you for being with us, and I look forward to our discussion.
Thank you, Esme. With that, it is now my honor to welcome Erin Kenny, Spotlight Secretariat Global Coordinator, to provide today's keynote address. Erin Kenny, please.
Thank you, Dr. Chimbiri, and thank you also for the wonderful shout out to Spotlight Initiative. Malawi continues to be a shining star example of this powerful initiative. And thank you, of course, to the European Union for being our founding partner and still a major investor in this critical initiative. I am Erin Kenny, the Global Coordinator of Spotlight Initiative, deeply honored to be with you today as your keynote speaker. Welcome, all of you, and thank you for taking the time to join this critically important conversation. We've gathered today to look at the evidence and dive into what recent evaluations across the UN system of what UN Women, UNHCR, UNFPA, UNICEF, and Spotlight Initiative are telling us about what works to end gender-based violence and what doesn't, and why, and crucially, ways forward in our collective efforts to end this violence. This conversation comes at a critical time. Our work to advance human rights, foster equality, and end violence is often 2 steps forward and 6 steps backward. Progress is rarely linear, and the backlash, especially now, is fierce. Funding is tightening, yet the need for sustained, coordinated action to end gender-based violence and advance women's rights remains urgent and universal. Gender-based violence continues to be one of the most pervasive human rights violations globally. New data from WHO shows that 1 in 3 women still face intimate partner violence and/or non-partner sexual violence in their lifetime, a rate largely unchanged since this data was collected in 2000. We know that the costs of gender-based violence are enormous for survivors themselves, for their families and communities, and for the societies in which we live. These costs are both direct and indirect, tangible and intangible, and felt in the immediate and in the long term. They include costs to healthcare and psychosocial services, law enforcement and justice, as well as impacts on lost income and diminished productivity at work and at home. The societal costs are stark. Global estimates from the UN and the World Bank suggest that countries can lose almost 4% of their GDP due to violence against women and girls, with violence against children costing countries up to 5% of their GDP. The European Institute for Gender Equality estimates that the cost of violence against women across the EU alone is 289 billion euros annually. At the country level, a study in Jamaica revealed that gender-based violence costs that country nearly 6.5% of its GDP. And we know that the true cost of gender-based violence is much higher and difficult, if not actually impossible, to fully quantify. Gender-based violence causes immense harm to survivors' health, well-being, security, and autonomy. The severe and often lifelong consequences include various physical and mental health morbidities and mortality. And we know violence is exacerbated in crises. As WHO recently reported, conflict, protracted humanitarian crises, and environmental disasters often exacerbate the risk of violence, as do displacement and its associated insecurity. The rapid proliferation of technology also exacerbates women and girls' risks of violence both on and offline. These harms undermine women's and girls' right to life, health, and well-being, and erode countries' and society's ability to achieve the Sustainable Development Goals. A modeling study commissioned by Spotlight Initiative and authored by Dahlberg, as well as studies from the Equality Institute and UN Women, unequivocally demonstrate that without addressing gender-based violence, we cannot achieve the SDGs. In addition to eroding progress on SDG 3 on good health and well-being, research has shown that gender-based violence compromises countries' ability to achieve SDG 4 on quality education by creating barriers to accessing and completing schooling. This limits women's and girls' ability to lead healthy, fulfilling, and economically independent lives. Violence against women and girls also impacts women's and girls' mobility and sense of safety in public spaces, including on public transport, limiting progress on SDG 11, Sustainable Cities and Communities. Gender-based violence discourages workforce participation, particularly where protections against harassment or abuse are weak, slowing progress on SDG 8 on decent work and economic growth. The Spotlight commissioned modeling study I referenced earlier showed that survivors can lose between 30 and 40% of their income and up to 30% of annual wages due to GBV-related absenteeism, productivity loss, and out-of-pocket expenses for medical and legal services. The evidence is resounding. Ending violence is necessary to advance gender equality and women's rights and promote inclusive and sustainable development. So shifting now from the costs of violence to the cost of inaction. Addressing violence against women and girls requires resources, and the money exists. The problem is how we're choosing to spend it. According to UNFPA, ending gender-based violence in 132 countries by 2030 will require investing $42 billion US. Yet in 2024 alone, the world spent $2.7 trillion US on militarization and just $458 million US on efforts to end violence against women and girls. That's nearly 6,000 times more on militaries than on women. Imagine what could be achieved if even a fraction of that went toward peace, equality, and safety. Launched in 2017 with 500 million euros from the European Union, Spotlight Initiative, the UN high-impact initiative to end violence against women and girls, has demonstrated that large-scale, targeted investment in rights-based, collaborative models to end gender-based violence work. In its first phase, which ran from 2017 to 2023, the initiative implemented 34 programs across 6 regions, bringing together 13 UN agencies under the leadership of the Deputy Secretary General at global level and resident coordinators in countries. Spotlight Initiative helps leverage UN agencies' complementary expertise to coherently roll out comprehensive programming across 6 interconnected areas. Through Spotlight, agencies and their partners work to help pass gender-responsive laws and policies, strengthen institutions, expand GBV data, deliver quality services, and promote gender-equitable social attitudes, behaviors, and norms, all in deep partnership with government and civil society. Now in its second phase, the initiative is consolidating learning and ensuring programming reflects the latest evidence, including the evidence that will be presented today. As the UN continues to evolve and adapt to a rapidly changing world, our collective response must be bold and commensurate. The demand is actually robust. And so, maybe now more than ever, the UN must work better together. We must harness our collective power and complementary expertise across agencies and mandates to ensure ending violence is everyone's business. When we act cohesively to roll out locally rooted, relevant, and responsive human rights and evidence-based programming to end gender-based violence, we can deliver transformative results. To do so well and sustainably, though, we must double down on our commitment to the principles of leaving no one behind and doing no harm. We must ensure our response engages and reaches the most vulnerable. We must also deepen our efforts to build meaningful partnerships with government and, critically, civil society, including particularly women's rights organizations and movements. Evidence shows that investments in women's rights organizations and movements is uniquely critical to ending violence against women and girls, and our programming must reflect that. The evaluations we are learning from today provide critical information on how to do all of this effectively and sustainably. So over the next hour and a half, we'll take a closer look at what works and what the evaluative evidence is telling us is critical for the UN to take forward to accelerate effective GBV action. This is a moment that demands urgency from us all. It asks us, as the UN, to fully leverage our collective expertise to end gender-based violence. It calls on governments to be laser-focused and unwavering in their political commitment to ending this rights violation and in matching rhetoric with public financing and action. And it urges donors and member states to fund this work differently through large-scale, core, sustained financing so that the UN, together with others, can collectively roll out the approaches that these evaluations we'll discuss today have shown to be relevant, responsive, and effective. Indeed, while gender-based violence is one of the most widespread and pervasive rights violations globally, we know how to end it. Thank you. Now let's listen in.
Thank you very much, Ms. Kenny, for your insightful keynote speech. Now, distinguished participants, we are moving on to panel discussion. Let's transition to the next segment of our program as we continue to explore the crucial role of evidence in advancing the response to gender-based violence. We now turn to our panelists who will share their perspectives and insights. First, I'm pleased to welcome Inga Kaplan, who serves as the Chief of Independent Evaluation Service for the UN Women. Inga, what does the recent UN Women evaluation say about efforts to prevent and respond to violence against women, and how do these efforts support localization, sustainability, and lasting change?
Thank you for the question, Dr. Chimberi. And good morning and good afternoon, distinguished delegates, advocates, and colleagues. So my insight in today's discussion draws on two UN Women's evaluations that provide critical insights on ending violence against women. The 2025 corporate evaluation on ending violence against women and girls, prevention and response, looked at UN Women's global and regional efforts, highlighting what works and where we need to adapt. It shows that integrated approaches, combining legal reform, institutional capacity, and community engagement are essential, and calls for innovation to tackle emerging threats, such as technology-facilitated violence. The 2024 Feminist Collaborative Evaluation on Social Norms reminds us that violence against women, social norms are the root causes of violence against women. It emphasizes participatory feminist approaches, co-creating solutions with grassroots women's-led organizations, engaging men and faith leaders, and using culturally grounded strategies to shift attitudes. So these two evaluations demonstrate that preventing and responding to violence against women is most effective when strategies take root in local communities and aim for long-term change. For instance, in rural Nepal, when women's groups supported by UN Women led local dialogues and mobilized leaders, all norms were challenged and community attitudes shifted. That once was considered a private issue, gender-based violence, became an urgent concern addressed openly and collectively. This is echoed globally. By connecting top-down strategies like legal reform and survivor-centered services with local partnerships and coalitions, UN Women has achieved sustainable change. The evaluation on the social norms is clear, but there is no universal blueprint. Localization, putting women's organizations and communities at the center is crucial. This means co-creating programs that reflect each community's values, such as collaborating with church leaders in Samoa or imams in Kyrgyzstan. Empowering local actors ensures solutions have both community trust and the resilience to outlast any single project. Sustainability is built on strengthening institutions and committing for the long term. Across many countries, UN Women equips police, service providers, faith-based organizations, and governments with the tools and know-how how to prevent violence and protect women. Then local institutions like religious groups in Ethiopia or state governments in India take ownership and invest in their own resources. Progress endures even as external funding waxes and wanes. Lasting change means tackling the underlying norms that allow violence to persist. The evaluations highlight the importance of involving men, faith leaders, and young people in the solutions. Initiatives such like ACT, Advocacy, Coalition Building, and Transformist Feminist Action Program, jointly run with the European Union, direct global support to grassroots organizations, ensuring that reforms, services, and shifts in mindsets are anchored in local realities and campuses beyond short-term projects. So in short, evaluation findings urges us to empower local actors, foster enduring partnerships, and directly confront the beliefs and structures that perpetuate violence. This is how we move from isolated interventions to sustainable, transformative change, and why investing in these approaches is key to finally ending violence against women and girls. Thank you.
Thank you, Inga. Next, I would like to welcome Julian Kobos, team leader for UNHCR's recent GBV evaluation. Over to you, Julian. What are some of the key challenges and strengths in implementing GBV activities in volatile settings? Julian.
Thanks, Dr. Chimbiri. I mean, the answer to the question is can vary quite a lot depending on whether we're talking about GBV response, prevention, or risk mitigation. I think some common challenges across all volatile settings, which include conflict and humanitarian crises, include, for example, the disruption of pre-existing services and infrastructure, and often the capacities to operate those. And I think what you also see in volatile settings can be the breakdown of community structures and also the government protection systems that can help to support survivors. So I think all of these issues are obviously intensified in a context of resourcing constraints, and that includes funding, but it also includes human resource limitations. So often in crisis settings, there's challenges retaining staff because of insecurity, trauma, and also burnout. So I was the team leader for the evaluation of UNHCR's approach to GBV. And the evaluation found that addressing these sorts of challenges requires a mix of long-term static staff and short-term roving or emergency staff. I think one of the problems that we found is that GBV emergency deployments are sometimes quite brief and you need time to build capacity in systems, and sometimes the deployments are for only 3 months. Our evaluation found really positive outcomes associated with longer-term deployments of GBV roving staff, at least 6 months, but potentially more than that. And these include increased efficiencies and stronger prioritization of GBV. I think if we turn to prevention, the challenges and strengths are a little bit different. So if we're thinking of GBV prevention activities, I think challenges include limited time and resources for the longer-term prevention work that's needed. In emergency settings, that can be quite challenging to do. And that's really compounded by instability, unpredictable security, and often community leadership being non-functional in crisis situations. So our evaluation of UNHCR's programming found that often prevention is deprioritized. And that's often because of perceptions that it's not life-saving. And we also found that stakeholders often question whether humanitarian agencies are really best positioned to lead on or support prevention efforts. And I think to challenge some of these views, I think we need to think of prevention also as life-saving. and really integrate it from the start of emergency response. So this could mean, for example, strengthening risk mitigation by mainstreaming GBV into different sectoral programs. And I think it's really important to invest early on in community engagement and the meaningful participation of women and girls. So establishing women's groups and community protection focal points and gathering insights from women and girls about protection risks can really lay the groundwork for stronger and more comprehensive prevention programming when conditions stabilize. So I think humanitarian agencies really do have an important role to play in supporting prevention efforts. Just to quickly come back to the question of GBV risk mitigation, I think this is usually the most immediately feasible type of programming in crisis settings. And that's because it focuses on reducing exposure to GBV by making humanitarian services and environments safer. So practical actions like installing lights, ensuring sex-segregated toilets, and training frontline staff in GBV risk mitigation can lead to women and girls feeling safer and also communities feeling safer. So our evaluation found really strong examples of GBV risk mitigation activities across different sectors, and also in camp and non-camp settings. But there are remaining gaps. And I think while we saw quite strong commitment to GBV risk mitigation across UNHCR operations, we also found challenges with accountability and community communication from leadership about the responsibilities of multifunctional teams to mainstream GBV risk mitigation. And I think this is also compounded by constrained resources. Staff are under a lot of pressure to deliver against multiple responsibilities, and that makes risk mitigation for a lot of colleagues an additional workload in the midst of competing priorities. Thank you.
Thank you. Thank you very much, Julian. I would like now to welcome Edward Bonnet, Evaluation Specialist with UNICEF. Edward, how are you credibly identifying knowledge gaps on what works to prevent child marriage, and what can we do to reduce our knowledge gaps?
Thank you, Dr. Chimbiri, for the question, and welcome everyone. Today we'll share a few insights from recent work that UNICEF did to prevent harmful practices, to improve programming to prevent harmful practices like child marriage. As you know, violation of child rights that persists in many countries. Just to name a data point, that every 3 seconds there is a marriage of a child girl. So it's over 20,000 a day, still today. In 2023, the UNICEF Evaluation Office worked together with the UNFPA Independent Evaluation Office to develop a new approach that we called the Impact Feasibility Assessment, IFA. And this methodology basically was designed to help us understanding which programs are most in need or are most feasible to make the investment, to receive the investment to conduct rigorous evaluations, and particularly impact evaluations. The idea was to determine if they truly make a difference or potentially can make a difference, these programs, and we can learn, anybody can learn from them to prevent child marriage. This impact feasibility assessment was applied across 12 countries, participating in the global program to end child marriage, run jointly between UNFPA and UNICEF. This is a multi-donor program that started in 2015 and due to end as planned in 2029. The countries include Bangladesh, Burkina Faso, Ethiopia, Ghana, India, Mozambique, Nepal, Niger, Sierra Leone, Uganda, Yemen, and Zambia. So the idea here with the program is to use a holistic approach to accelerate the action to prevent, eliminate child marriage by strengthening national systems, addressing poverty, mobilizing communities, and empowering girls. And different strategies are used to this. The idea of the impact feasibility assessment was that through a transparent and systematic process, We scanned several available rigorous evidence pieces that would tell us what works, what programs work to prevent child marriage. And the IFA, the Impact Feasibility Assessment exercise, identified this way several critical knowledge gaps, areas where we do not know enough, basically. For example, we do not know enough if and how programs that engage key social influencers or community influencers, let's say, religious leaders, role models, are effective in changing social norms, the gender, the inequitable social norms behind child marriage, for example. We also need more evidence to understand if and where gender transformative programs, as the ones within the Global Program to End Child Marriage, that involve men and boys actually work, and how do they work, for whom they work, or what the impact is of using, for example, edutainment or digital media activities. Other gaps include understanding the combined effects, for example, of multi-package, multi-component programs that are the ones particularly relevant and utilized mostly in this type of holistic approaches. The impact feasibility assessment, after that identification of knowledge gaps, assessed all the program countries, all the programs across the 12 countries, to identify which ones were the most suitable ones to conduct impact evaluations. And after this exercise that was taking into account, for example, looking at what is the political will in each country receiving the programs, to uptake the results of an impact evaluation. What is the operational feasibility to access those areas where the interventions, the programs take place to conduct impact evaluation? What are the local data capacities? Is this feasible? And what are the promising components of the interventions? Are there scalable elements, particularly? Based on this impact feasibility assessment identified 4 cases in Bangladesh, Ghana, Niger, and Zambia that had the most suitable programs for impact evaluation. So, following your question, Dr. Chimbiri, then what did we do? What could we do to fill those knowledge gaps that we identified this way with this impact feasibility assessment? Basically, in general, we would say that we need to prioritize investments, obviously mobilize a sustainable and predictable demand, also an informed demand, and be ready to provide technical and financial support for this type of exercises that are long endeavors. Impact evaluations, as you know, would be the gold standard to determine whether a program works and how much it contributes to the desired outcomes or the planned outcomes of a program. And when they are well designed, impact evaluations, and combined with qualitative methods, particularly and cost effectiveness analysis, they can tell us not just if a program worked, but for whom worked, why it did, and at what cost also. With all this in mind, and I'm finishing here, in 2023, following also the impact feasibility assessment, UNICEF launched the Impact Catalyst Fund, which was basically a program that is still running now. It's a competitive call within UNICEF for open to offices and regional offices that they can come and propose impact evaluations to be conducted of particular programs that offer strategic, innovative, or scalable opportunities. The first competitive call of this program in 2023 was on focusing on child marriage and social norms, precisely because this was allowing to benefit from the learned gaps and mobilized interest that the impact feasibility assessment exercise had promoted. That first round of the Impact Catalyst Fund received more than 15 proposals, adequate proposals, matching the criteria, from where after careful assessment, 6 of them were selected, and to be co-funded and to be receiving technical support for the conduct of impact evaluations. 5 of those 6 are already impact evaluations that are underway in Burkina Faso, in Ghana, India, Niger, and Turkey. Some of the countries here beyond those 12 that I mentioned before, while the country left, Lebanon, is still on hold due to funding. And just to finalize, notably all of these impact evaluations that are advanced include populations affected by fragility and conflict.
Thank you. Thank you, Edward. And next, I would like to welcome Ma Jubero, GBV Technical Specialist at UNFPA. Ma, How is evaluation evidence helping to shape and refine UNFPA's GBV prevention programming and strategic direction? Ma, over to you.
Thank you very much for the question, Dr. Chimberry. At UNFPA, evaluation evidence does more than inform our GBV work. It shapes it from the ground up. Insights from program evaluation, joint UN assessment, and sister agencies like UN Women, UNHCR, and UNICEF guide what interventions truly reduce violence and strengthen program design. Let me start with our operational plan for GBV, which we call Flourish. It's the backbone of UNFPA GBV work. Flourish was designed based on global and interagency evidence, including UNFPA's 2018 corporate evaluation on GBV and harmful practices, lessons from county program reviews, and guidance from the GBV area of responsibility. It also drew from the essential services package, the minimum standards for GBV in emergencies, the respect framework, and evaluations from the harmful practices portfolio. Evaluations have shown that gender transformative group interventions, community mobilization, and multi-component economic empowerment programs can impact intimate partner violence. Effective prevention combines long-term, multi-level interventions, community engagement, social norms transformation, education, promotion of positive masculinities, women's economic empowerment, and digital safety. It also emphasized the leadership of women's rights movements and contextually relevant approaches to ensure sustainability. But impact depends on more than the type of intervention. Going beneath the top-line evaluation messages reveals the real goal for programming. Success requires gender transformative approaches, quality design and delivery, and sufficient intensity and duration. Evaluations consistently highlight that integrated programming, linking quality services, strong systems, community norm change, and robust data is what supports sustainable reductions in GBV. While a single intervention can succeed if well designed, lasting impact comes from coordinated multi-component approaches. Flourish embodies this approach, moving UNFPA from fragmented project-based work to coherent multi-sectoral systems-driven programming. As we update Flourish, we draw on new evidence from the Spotlight Initiative Phase 2, Global GBV Mapping, the Know-How Data Initiative, and extensive consultations with country offices. This ensures that UNFPA's next phase builds on what works while addressing gaps. In parallel, UNFPA is developing GBV prevention guidelines, grounded in global frameworks like Respect and Inspire, and informed by the What Works to Prevent Violence Against Women and Girls program. These guidelines integrate insights from partner agencies' evaluations and a comprehensive internal assessment of prevention programming across over 150 country offices, identifying what is already working and where guidance is most needed. Together, the updated Flourish framework and the GBV prevention guidelines provide a coherent, evidence-based direction. They sharpen programmatic choices, strengthen measurement frameworks, and ensure UNFPA GBV work is grounded in proven practice, while remaining adaptable to emerging needs, including technology-facilitated violence, climate change, and locally led interventions. In short, evaluation evidence is not an external requirement. It is the engine of our strategy. It guides priorities, shapes tools, strengthens accountability, and ensures that UNFPA's GBV programming evolves in line with what is proven to work. Thank you so much, Dr. Chimberry.
Andrea Cook, Executive Director of the UNSDG System-Wide Evaluation Office. Andrea, what learning did the evaluation provide regarding the potential for an integrated UN approach to address violence against women and girls and to contribute to higher order changes at national and regional levels? Andrea, please.
Thank you, Dr. Chimbiri. It's a real pleasure to be with everyone today. So the evaluation we conducted in 2024 was an independent evaluation to assess the overall performance of the Spotlight Initiative, but also to contribute to understanding progress on United Nations reform set out by the General Assembly in Resolution 72279. It covered the implementation at the global, regional, and country levels and focused on 7 areas of investigation. And in parallel to the evaluation, we undertook a value for money assessment to assess the economy, efficiency, and effectiveness and equity of the Spotlight Initiative. This study analysed the costs, management structures, operational practices, and whether resources were allocated and used in a way that maximised the impact of the Spotlight Initiative. Overall, the evaluation found strong proof of concept for the Spotlight Initiative 6-pillar integrated model to address violence against women and girls. But it also highlighted areas for improvement. The value for money assessment found that the Spotlight Initiative demonstrated strong responsiveness and adaptability to external factors and conceptual changes, including political instability, natural disasters, and the COVID-19 pandemic. And it did so by employing creative approaches to adapt implementation. The evaluation showed that a comprehensive whole of society, whole of government approach contributed to higher order results across all 6 pillars at both the regional and national levels. This included working to pass progressive laws and policies, to strengthen institutions, to expand GBV data systems, to deliver quality services, and to promote gender equality, social norms and attitudes. And it did this in partnership with government and in particular with civil society. The evaluation found that this works and works well. At the national and local levels, Spotlight raised the visibility of eliminating violence against women and girls on the national agenda. It encouraged multi-stakeholder collaboration, strengthened civil society organisation around this issue, and increased government ownership of a comprehensive approach. It raised awareness among communities and supported changes in mindsets. It strengthened response systems and improved referral networks and integrated services for sexual and gender-based violence. And above all, it empowered women and girls to understand their rights and have a stronger voice. I'd like to highlight some good practice examples. For example, in Kyrgyzstan, laws and policies were adapted comprehensively that led to a stronger legal framework to address gender-based violence. In Argentina and Honduras, access to legal aid services was strengthened and targeted training was delivered on survivor-centric investigative techniques. In Honduras, Kyrgyzstan, Malawi, Mozambique, and Nigeria, national stakeholders we consulted identified strengthened response systems and improved referral networks, and improved integrated services for victims and survivors as evidence of higher order changes. In Malawi, in partnership with the Ministry of Local Government and Rural Development, engagement with traditional leaders was enhanced by establishing chiefs forums and the development of a national framework to provide space for dialogue and peer-to-peer learning and exchange on preventing and responding to violence against women and girls at the community level. At the regional level, the Spotlight Initiative raised the visibility of the issue of gender-based violence among intergovernmental institutions and enhanced the collective understanding that responses require a multi-sectoral approach. The evaluation also noted challenges in implementation. For example, the operational model was overly complex for the speed and scale envisaged by the initiative, and UN administrative and financial systems often limited interagency delivery and coherence. The evaluation made 8 strategic recommendations to guide future multi-agency programming and to strengthen system-wide coherence and sustainability in this area. Thank you.
Thank you to the panelists. And thank you to the panelists for your detailed insights. Moving on to a second round of questions, beginning with Julian from UNHCR. How can we ensure that context-specific GBV expertise and prioritization of GBV programs remains central to the delivery of services in the humanitarian settings? Julian.
Thank you. So, I mean, we've heard from other colleagues in the webinar on the importance of local partnerships and localization. And so I think context-specific GBV expertise has to engage with local partners and civil society organizations and women-led organizations. But I do want to focus my response on something else, which is the expertise, the GBV expertise that we have within organizations. And I think one of the UNHCR evaluation results was that we see a shift away from GBV specialist organizations and partnerships and a movement towards generalist partnerships. And that's linked to the funding, constrained funding environment as well. So sort of moving towards generalist partnerships that can do multiple things, including GBV. But what we also see across the board is that there's a reduction in GBV specialist roles within partner organizations, but also within UNHCR, and that's also linked to constrained funding. So while generalist organizations can be effective if they have the right internal expertise, lacking this expertise inevitably leads to a decline in program quality. And so the evaluation that we did really underscores the need for clear and consistent guidance and criteria to assess GBV partners and ensuring that both generalist and specialist partners have the necessary institutional capacity and expertise. And it's really essential for delivering effective, high-quality GBV programming. One of the key challenges is ensuring that GBV prioritization is reflected in resource allocation. So our evaluation did find some gaps in prioritization for UNHCR, prioritization of GBV, and we made a couple of recommendations on how to address these gaps. One was to implement actions to ensure that GBV is not consistently deprioritized, and that can include, for instance, developing budget red flag mechanisms. So a red flag mechanism that's triggered if there's an early leadership action or when GBV resources are disproportionately deprioritized, and especially in locations most in need. So this could be one of the recommendations, and this can be complemented with other actions. For instance, making sure that there's really strong accountability from senior managers and leaders. For instance, integrating GBV implementation responsibilities and measurable targets into leaders and managers' performance appraisals. So I think there are a couple of the recommendations that came out of the evaluation that we did, specifically related to partnership and prioritization.
Thank you, Julian. Edward from UNICEF, what are the learnings from your initiatives to generate evidence and demand for evidence from rigorous impact evaluations? Edward.
Yeah, thank you. Let me focus on a couple. First, let me start saying that the first learning would be that now we know that the impact feasibility assessment methodology that we created and used in 2023 in the context of the global program to end child marriage that I explained before is adaptable, and it has already been successfully used in other areas to identify knowledge gaps, and prioritize what we need to learn on what works, what programs work in a specific area, using a credible, transparent, open manner, a procedure. And we use this in mental health and psychosocial support to identify what programs merit most our investment for impact evaluations. In programs for migrants and host communities, for example, in the Prospects program, or in water and sanitation and hygiene programs across UNICEF. Now, from our experience with the impact feasibility assessment, but also from the Impact Catalyst Fund and the impact evaluations ongoing, and that includes, I'm gonna refer also not only to the ones that were on the prevention elimination of child marriage, but also others related to mitigation, prevention of GBV in fragile settings. For example, innovative programs like LAHA, that it's a virtual safe space for girls and women that poses particular challenges for impact evaluation because of its innovative approach. It's a digital safe space, basically, for girls. That also brings us learnings. It's an ongoing impact evaluation, quite challenging, but requiring quite a creative effort, a collective effort behind it. Let me share a few lessons. First, there is a need to focus on programs that have predictable funding, because impact evaluations understand what works, require that the results of programs mature, and normally this happens beyond 1 year time, 2 years, some cases more even, particularly for prevention child marriage, for changing behaviors and attitudes, which allows us to assess this way real changes, in outcomes and impact once there is maturity. Second lesson would be that there is a need to create cross-country synergies and opportunity when we do this type of exercises to try to learn what works. For example, treating evaluations as a learning portfolio, not isolated studies, and that facilitates bringing together countries involved, trying to address same issues through different strategies, but related strategies that are properly localized. In this case, changing social norms, empowering marginalized girls, linking projects and programs with national systems, so on and so forth. So there is a lot of learning space here, and that has to be mobilized intentionally, and that offers this opportunity to do so. There is a need to measure the implementation quality of our programs to understand and make conclusions on what works, and then eventually understand what is the fidelity, the adaptation, acceptability, and operational synergies of what's at stake, not what's being done. And then finally, and then I will conclude here, is it's important to treat these impact evaluations because they are long processes and require investment. That's why it's very important to treat them from a learning point of view, and treat them like iterative learning cycles, basically, and that opens the opportunity to hold workshops and share knowledge along the implementation process of these evaluations, and to capture ongoing insights, not to wait until the end. And let me give a couple of examples from ongoing impact evaluations. One would be, for example, on the programs to end child marriage in Burkina Faso. Simply baseline data shows that that program interventions, particularly in this case in Burkina Faso, are well targeted. Just because, for example, a little bit less than 5% of the 150 villages that are targeted in this program, in this evaluation, particularly, a little bit less than 5% of these villages had ever been exposed to campaigns or services related to the elimination of child marriage. That's important because that will allow to assess how they change. All these villages, if they have been exposed previously to some programs intending to eliminate child marriage, that would not be a good way of investing our program efforts, but also the impact evaluation efforts. Another element that is allowed to identify and conclude that the target was for example, the baseline identified that the majority of the village leaders in Burkina Faso in the targeted villages thought that the ideal age for a girl to get married, for a person to get married, for a woman to get married, is to be under 18. So there is something to be changed here in the beliefs of these community leaders. And similarly, in the example of Ghana, for example, where we know that new measurement tools on attitudes and social norms on gender, child marriage, and female genital mutilation, practices are needed. Particularly, for example, to try to assess the change of our programs in Ghana when nearly 75% of the caregivers of unmarried girls believe that known or other people in the community think the same way as they do. So they feel quite isolated, no? That's the pressure that they feel of the social norm. And that requires an additional effort to be able to measure this in a relatively light manner and with quality. I will stop it here. Thank you, Dr. Chimbiri.
Thank you very much, Edward. And now Andrea from the System-Wide Evaluation Office. What could be done to address the operational challenges identified by the evaluation, and what insights did the value for money assessment provide in this regard? Andrea.
Thank you. Well, the evaluation and the VFM assessment, as I said previously, found that the Spotlight Initiative faced a number of challenges. And this included a very ambitious and complex results framework that proved challenging to operationalize, an unclear rationale for country selection and budget allocation, initially very slow operationalization and implementation rates, complex fund replenishment processes that affected the pace of implementation, inefficiencies in coordination among multiple UN agencies, and underestimation of risks and the impact of operational issues linked to internal UN system processes. And there was also insufficient integration of learning and knowledge management. In particular, the overall lack of harmonization across administrative and financial systems within the United Nations created some confusion and quite a lot of challenges for implementers. And this contributed, particularly in the early stages of the initiative, to significant delays in recruitment and procurement processes, which complicated program coordination efforts and contributed to personnel turnover, further compounding other system operational bottlenecks. The need to deliver at a fast pace was often at odds with United Nations entity procedures and processes, which were moving much more slowly. The assessment recommended creating a clear value for money framework, simplifying indicators, strengthening civil society engagement, and above all, developing a coherent sustainability and resource mobilization strategy for future phases of Spotlight. A significant barrier to progress in the delivery of a coherent United Nations system response at country, regional, and global levels is related as well to development partner preference for individual over joint entity engagement and competition for funding, which is underpinned by entity incentives and accountabilities. These are important findings which are challenging for the United System, and they were also corroborated in our recent system-wide evaluation on progress towards a new generation of UN country teams. The evaluation recommends the development of holistic funding strategy to step up collective United Nations programming to address violence against women and girls at all levels, and to learn from the Spotlight Initiative's comprehensive model and approach, but also to draw on the principles of the United Nations Development System reform, the commitments of the funding compact. And as we look ahead, it's important to bring these aspects to bear in the reforms that are currently being analysed and enacted under the UN80 initiative.
Thank you, Andrea. Inga from UN Women. What are the key lessons and opportunities emerging from recent evaluations on prevention and response to violence against women and girls at UN Women? Inga.
Thank you for this question. UN Women's evaluations highlight 5 powerful lessons and opportunities. So the first one, that localization works and trust-based partnerships and flexible funding empower women's grassroots organizations. But there is one of these persistent barriers there, how to access donor funding for the small women's organizations. So this is one of the barriers that need to be caught and worked to remove. Second, integrated approaches deliver impact. I mentioned before that combining reforms, institutional capacity building, so community engagement, so create sustainable change. And for instance, one of UN Women's initiatives that always is assessed very positively is Safe Cities model. So the model that is actually nationalized and implemented by cities and funded by different governments themselves. And Safe Cities, so this is a program that tries to reduce violence against women in public spaces. The third, that social norms change is essential. And now I think there is a big opportunity here to really expand that programming and scale it up, because in order to address violence against women, we have to address social norms. The fourth is innovation is urgent. So the rise of technology facilitated gender-based violence needs to be addressed. And UN Women has some initial work done under Generation Equality Forum, some partnerships with high-tech companies. So, but also working with some governments, providing some guidance and regulatory framework. But this work is in very initial stage and lots of thinking needs to be done in this area. And fifth, sustainability needs long-term investment. So multi-year flexible funding and stronger coordination with women's organizations is critical for this long-term change. So ultimately, the opportunity is to scale what works. And what works, we know: local leadership, integrated systems, social norms transformation, and tech-driven solutions. Thank you.
Thank you, Inga. And Ma from UNFPA. How is UNFPA leveraging evaluation to build the evidence base for effective prevention and response to technology-facilitated gender-based violence? Ma.
Thanks so much, Dr. Chimberi. UNFPA is taking a leading role in this new emerging area of work, which is confronting the fast evolving challenge of technology-facilitated gender-based violence through our first global program on the issue, which is called Making All Spaces Safe. The program was intentionally designed not only to be grounded in the latest global and local evidence, but also to actively strengthen the overall TFGBV knowledge base. Evaluation is central for us in this approach. At the heart of the program is a strong monitoring and evaluation architecture that allows UNFPA to track what works, what's not working, and why. We are conducting continuous evaluations of targeted interventions, including focus country work in places such as Benin and Kenya. This combination of evaluation This combination of evaluation at the local level and global analysis ensures that our interventions are context-specific while still generating insights that can inform global standards and guidance. To consolidate and share this growing body of evidence, UNFPA is establishing a global TFGBV repository and knowledge hub, drawing on contributions from more than 30 country offices engaged in TFGBV programs. This hub will serve as a central platform for research, lessons learned, and emerging promising practice, accelerating cross-regional learning and improving the quality of programming worldwide. Because TFGBV manifests differently across cultures, languages, and platforms, UNFPA is investing in context-specific and language-specific research to better understand these variations. This research directly informs the design of the forthcoming TFGBV Global Response Hub, a practical tool for frontline service providers from social workers to police to health personnel. The hub will offer tailored evidence-based guidance that reflects local realities while upholding global standards for survivor-centered response. In sum, UNFPA is leveraging rigorous evaluation, country-driven evidence, and global knowledge sharing to build the strongest possible foundation for preventing and responding to the emerging work on TFGBV. Our goal is clear: to ensure that every space, online and offline, is safe for women and girls. Thank you so much.
Thank you. Thank you very much, Ma. Lastly, distinguished participants, I would like to pose the same question to all the panelists. Drawing on the collective evaluation insights presented today, what strategic priorities should guide the UN's next phase of GBV action? Each to speak for 1 minute. And I will start with Erin. Erin Kenny.
Great. Thank you, Dr. Chimbiri. Okay, 1 minute. So first, donors and governments should invest in women's rights organizations and movements as a priority. We know that they're uniquely positioned to drive transformative change and yet are critically underfunded, especially now. Priorities should include advocating for core, flexible, predictable financing for these organizations as a first priority. Second, the UN must prioritize joint long-term resource mobilization, and donors, member states should fund the UN and this work with core, predictable funding. This will help foster cooperation amongst agencies and allow the UN to more readily roll out the rights-based, responsive, relevant programming needed to address GBV. And finally, we must continue to invest in comprehensive approaches. All of the evaluations have shown this is the way to go. Spotlight demonstrated this proof of concept, but it's not unique to Spotlight at all. This is something that we all know is just good practice, and we all need to invest in this. This is a sustainable approach for the long term.
Thank you, Erin. Over to you, Edward Bonnet.
Thank you. I hope that we're not going to be very reiterative with some of the points, but I think it's good to confirm that they are going to be in some case the same. No? So looking ahead from UNICEF's side, I think there is clearly a need to expand the coverage scope of impact evaluations, especially for scalable, innovative, and programs, projects in fragile and humanitarian contexts in particular, because we know that timely and contextualized evidence on outcomes and impact change that is caused by our programs, this information can help agencies, organizations, and stakeholders, also governments, to stay relevant to their own constituencies, to national policy processes, and demonstrate results in diverse settings. This, in a context, measuring effectiveness of our programs and understanding whether they are effective and for who, no, and why particularly, is very important and helps making a credible case for our work in a moment where the allocation of resources is even more allocating well the resources is even more important than ever. Because they are quite scarce. So I will try not to reiterate what Erin just mentioned in relation to the stability of the partnerships, but that it's important. Let me bring here another angle to that, particularly the predictability, I would say, with donors and other organizations are very essential, and also the engagement and the joint development and identification of needs to develop evidence on what works and what does not work is important also, and will help in the midterm and long term to reduce costs, foster credibility, and develop ownership. And that's very important in a context, particularly for fragile and humanitarian contexts, where conducting impact evaluations that are rigorous, the gold standard type of impact evaluation, is even more complicated and requires capacity to adapt to those challenging contexts and even be flexible and creative to adapt approaches, methodologies, and not only to programs, but also to the impact evaluations and the measurements that we undertake. Finally, just to emphasize that it's as a heads up, no, UNICEF Evaluation Office committed in the coming Global Evaluation Plan for 2026-2029, the coming 4 years, committed to the Executive Board of UNICEF to conduct a global evaluation on the prevention of violence against girls and boys and women next year, and to initiate in this cycle several impact evaluations on the prevention of violence against children in and around schools in fragile contexts and crisis contexts. So stay tuned, and we will be most likely able to jointly put in motion the discussion points that we covered here. Thank you very much.
Thank you, Edward. Julian?
Thank you. I'd like to raise 2 strategic priorities. The first is around where funding is being concentrated. I think in the current crisis, it's really important to balance support for response prevention and risk mitigation. So we know that survivor-centered response services are really critical, absolutely essential, and they are life-saving. And we know that they're often under-resourced. But long-term progress requires sustained investment in prevention. And what we saw in the evaluation is that prevention is often the GBV programming element that keeps dropping in times of funding crisis. We can't continue to deprioritize prevention efforts in a resource-constrained environment, because this will continue to perpetuate cycles of GBV response. And the second one, I think, picking up on what Erin and Inga have already said, is the absolute essential strategic priority to work on localization and support women-led organizations. The UNHCR evaluation found really strong results linked to GBV programming supported by women-led organizations, and these efforts need to be scaled up, but we really need to address the persisting barriers that women-led organizations face. Thank you.
Thank you, Julian. Ma?
Thank you so much. I think we are all in agreement here. And as it has already been said, we must prioritize sustained institutionalization of comprehensive multi-sectoral programming and empower localized civil society leadership, as it has just been mentioned, and women-led organizations. And also secure predictable multi-year financing, which is getting more and more complicated, but it's essential to shift social norms and ensure survivor access to justice and quality integrated service. And I think also in the context of resources scarcity, we need to frame evaluation as a tool that increases efficiency, accountability, and programmatic impact. If we need to prioritize evaluations to see which interventions are working and can be scaled up, which interventions need to be adapted and framed in a different way. So I think that's essential, that we don't deprioritize evaluations in this context of resources scarcity, but that we make them essential. Thank you so much.
Thank you, Ma. Andrea?
Yeah, thank you. So very briefly, with shrinking resources and capacities, it's imperative for the UN to streamline and refocus its work in this area, whilst maintaining a coherent and integrated approach. Our evaluation of the Spotlight Initiative recommended embedding a comprehensive approach to gender-based violence and learning from the Spotlight Initiative into the implementation of the United Nations system-wide Gender Equality Acceleration Plan, into the United Nations system-wide action plan on gender equality and women's empowerment, both at the global level, and importantly, at the country level, requiring the integration of a gender-based violence sort of perspective within common United Nations development system processes, in particular the common country analyses and United Nations cooperation frameworks, which are the building block of coherent integrated action across the UN family at the country level. And these elements are really crucial if we're going to extend the geographical reach and coverage of comprehensive and sustainable programs to address gender-based violence.
Thank you. Thank you, Andrea. And finally, Inga.
Thank you. I think lots of points were already stressed and expressed by my colleagues. Maybe just to emphasize one, scale the social norms transformation. So really address the root cause of violence against women and girls. And our feminist collaborative evaluation is very clear that changing harmful norms is non-negotiable. So it's very important to invest in participatory and context-driven strategies, and of course, engage men and boys and communities. So I will end with this point.
Thank you very much. Thank you very much to you all for your insights. We have learned a lot. Now we are going to the section on open Q&A. We will transition to that segment of our program. I will now hand it over to Henry Van Den from UNHCR to open the floor for comments and questions. Over to you, Henry.
Thank you a lot, Dr. Chimbiri, and thank you, participants here today and panelists. So I would invite any participants to raise their hand. We've gone a little bit over time. There's been a lot discussed. And so I would give you an opportunity to please raise your hand and open your mic. I would perhaps maybe just start with one question, because we've received a few through the registration form, and most of them have been answered through your responses. We've talked about general challenges with expertise, staff capacity, deprioritization of prevention. We've talked a lot about the solutions as well, on focusing on holistic funding, on tackling the inefficiencies within the UN bureaucratic systems. So the question that remains then from the registration form is focusing on utilizing evaluative evidence. So Mars spoke a little bit to this on when she said advocating for evaluation and not losing sight. But the question then to the panel is, in your experience, what are the most significant barriers that prevent evaluation findings from being translated into concrete GBV policies and programs? And what can we share with people here today on how we might mitigate those barriers for utilizing evaluation? Over to you.
Thank you. So I would be happy maybe to start. So it's a great question. I think, first of all, it's really very important to frame evaluation as a strategic investment to our managers, donors, also our partners and beneficiaries who benefit from this evidence-based advocacy. Another point, I think what we particularly learned from feminist collaborative evaluation, so really engage in evaluation forms, but engage managers, that engage program beneficiaries in co-creating the solutions, in co-creating findings, in co-creating recommendations. I think in that way, so that learning is happened through the process. And I think that the feminist collaborative evaluation that we did, so that covered a number of countries, so involved our program staff in co-creating evaluation findings, involved local communities in discussing the findings and providing insights on what works in their communities and what type of programming should be in particular community to address ending violence against women was critical. So I would say it is the strategic framework of evaluation as very important for any type of evidence-based decisions in organization. And second, thinking about the innovative ways to engage our managers, donors, communities themselves, where they see the value of evaluation.
Thank you so much. Andrea, I see you want to respond as well, and then I've got a raised hand in the audience that I would like to open up. Yeah. Sorry.
Yeah, so this was actually something that the system-wide evaluation on the Spotlight Initiative looked at and made recommendations on. So firstly, I think there's a need that in our evaluation practice, first of all, we expand and systematize the utilization of qualitative approaches to our work so that we're capturing a richer and more holistic picture of program results on the ground. We're often not very good at that. So demonstrating really tangible results of learning coming directly from beneficiaries themselves is really important, because that produces the compelling evidence that decision makers and funders can take into consideration. Secondly, this is something that the Spotlight Initiative I know are sort of looking at. This needs to be taken alongside many other interventions in a very crowded space and shrinking space for funding. GBV, whilst it's a human rights issue fundamentally, is also having to be considered as an investment decision by funders and decision makers. So one of the things we learned and recommended from the BFM assessment was making sure that we're collecting robust evidence of the kind that Edouard is talking about, but also that we're collecting information on cost, and we're able to do a slightly more sophisticated cost assessment and related to benefits of gender-based violence mitigation and prevention to make the case for why this is so important. And finally, we need to develop much stronger systems within entities, but beyond the UN system as well, to enable real-time learning and knowledge sharing. And that's really fundamental to drive scaling up of good practices and innovation, and to support, as I said, replication of what's really working and transferal of good practices from one context to another. So those are all fundamental for us to be addressing within our evaluation work, but going much beyond that to the actual programmatic and policy side of our institutions.
Thank you so much, Andrea, for that comprehensive response. I fully agree. They actually resonate a lot with the recommendations coming out of UNHCR's evaluation, specifically on the use of data, on strengthening systems to demonstrate results and impact. So yes, very much agree. I actually see that the hand in the audience that I spoke about was Mar from UNFPA's hand, excuse me. So I don't know, Mar, you want to come in with a response now? Because we have maybe just a minute, and then we've got to have a closing session for the European Commission for ESME as well.
Okay, unless if there are other questions from the audience, then I'm fine.
Okay, there's no other questions from the audience.
Okay.
Yeah. So should we hand over, or you want to respond?
I just maybe quickly,
Sure.
A point that has briefly been mentioned, the lack of participatory design methodologies since the beginning involving beneficiaries. If this is not included since the beginning, then it might result in evaluations not being implemented. And also sometimes there is not a clear roadmap on how it should be, the evaluation should be rolled out and implemented in communities, or poor dissemination of the findings. So just to add that.
Thank you so much, Mar. I think with that, I'll hand over back to the co-chairs to, I believe, ESME. Thank you.
Yes, thank you very much, Henry. And sincere thanks to all our speakers, panelists, and to the participants for an extremely rich discussion. I think over the past 90 minutes, we've heard a clear and consistent message. To end gender-based violence, we need stronger evidence, stronger partnerships, and stronger commitments, both politically and financially. The evaluations presented today underscore both how far we have come, but also what we still need to do. A few key takeaways and reflections. First, I think the evidence shows that our work is having impact. Across the different evaluations, we heard concrete insights about what is effective. Comprehensive whole of society, whole of government programs designed around local realities. Long-term community-rooted prevention efforts, integrated survivor-centered response services, investment in norm change while engaging men, boys, and traditional leaders. We've also heard that many of these achievements remain highly dependent on the context, on institutional stability, and on long-term investment. The lesson is unmistakable. Short-term project-based responses are not enough, because ending GBV requires sustained, predictable, and multi-year support. Second, a powerful message concerns the importance of localization. We see that programs work best when they are shaped by local knowledge, owned by communities, and responsive to the realities of women, girls, and young people. And women's rights organizations play a central role in this, because these organizations are the backbone of prevention and response efforts. At the same time, they face shrinking space, unpredictable financing, and administrative burdens that can be overwhelming. If we want to create sustainable change, then shifting resources, decision-making power, and capacity directly to local women's organizations is essential. As we heard today, simplifying our financing processes and reducing bureaucratic barriers is part of that commitment. We were also reminded that coordination is not a technical exercise. It is a strategic choice. Evaluations show that when we align efforts, harmonize processes, and reduce fragmentation, the results are felt on the ground. The Spotlight Initiative is a good example of such a joint programming model. Lastly, the conversation spotlighted the urgency of addressing emerging forms of violence, including technology-facilitated gender-based violence. Evaluation evidence can help us move to proactive, preventive strategies, ensuring that digital transformation goes hand in hand with rights, safety, and inclusion. I think as we move forward, we need to remember that evaluation is our clearest pathway to accountability, learning, and impact. Evaluation helps us to understand what truly works for the people we aim to serve and gives us the evidence to do better, create lasting change. From an EU perspective, all these reflections resonate strongly. The EU is committed to advancing gender equality and to eliminate all forms of gender-based violence, including by building on these lessons, on the lessons of today's evaluations, and on the work of the Spotlight Initiative. We are committed to working with the UN and our global partners to strengthen evidence-based programming, to ensure better resourcing, and to champion the rights of women and girls everywhere. As we leave this webinar, I hope we can carry forward a shared commitment to turning evidence into action, complexity into coherence, and intention into impact. The scale of gender-based violence demands nothing less. To bring our session to a close, I'll now hand over to my esteemed co-chair, Ambassador Chimbiri.
Thank you very much. Thank you, Esime, for that very good summation of what has transpired during this webinar. We would like to extend our sincere appreciation to all participants today, and in particular to our speakers from UNFPA, UNHCR, UNICEF, UN Women, UNSDG, System-Wide Evaluation Office, and the Spotlight Initiative. And in particular, a special thanks to EU for supporting this initiative that has really shown results. So today's discussion reinforces our collective responsibility to confront gender-based violence with urgency and resolve. Let us continue working together to accelerate and scale up the changes needed to ensure safety, dignity, and protection for every woman, girl, and child. As Andrea mentioned in her remarks, one of the responses, this type of analysis and evidence will be valuable to the UN-80 reform process that is underway at the UN. I would like to take this opportunity to thank you all for your participation, your questions, your insights, and I think it's work, it's ongoing. We should continue to reflect, and we should also contribute to any of the processes that we are involved in to make sure that we protect our women, girls, and children. I wish you all happy and restful holidays and prosperous New Year. I thank you all.